Hi, I'm Jenina Angela Esguerra-Paculan. I'm a doctor from the Philippines. I'm a practicing general surgeon, and I work in the suburban area in Rizal, Philippines. I did a master's in acute medicine through the Merck Foundation Capacity Advancement Program in the year 2022. I was given the chance to study in the University of South Wales for the Masters in Acute Medicine. Now, the faculty were very approachable and they were very knowledgeable about a lot of things that you ask them. So sometimes they will teach you not the answers to the questions, but how to find them, which is more important because you have a lot of different problems in the different places wherever you are. For example, in our country, tuberculosis you can find it anywhere. You can find tuberculosis infection in the breast, in the abdomen, on the skin, on the lungs. And the approaches to these kinds of diseases are very different from if you're in a city or when you're in the province. So I think what Merck Foundation gave my community is that they gave me a tool on how to find the answers to these questions that we have regarding health. So after completing the Master's in Acute Medicine, I opened a clinic so that I'm doing a private practice in my community. But then I opened a clinic wherein every weekend I would welcome consultations in the community. I did that, and we only did mostly diagnostics and antibiotic treatment for infection. And then I had to close it because there was only me, and a lot of people started coming during the weekdays. So what we did next is, through the help of the Philippine Medical Association, they recognized the skills that I've acquired from the course. And whenever we have a medical mission, we gather medicines from the association, and we have more doctors. And I helped them with protocols, and I helped compose a checklist or a diagram for the simplest infection that there is. So we started going into the indigenous community of Rizal. So we have people who have not had consultation since birth. So we visit them, and that's it. The problem with the Philippines is we have 7,641 islands, and 2,000 islands are actually inhabited on record. But there are still some islands that are inhabited and are not on record as of the moment. So despite having a city in the Philippines and a lot of doctors, they're mostly concentrated on the city. They work in the city, and they work in government hospitals in the city. So the problem is transporting these people who need medical attention into the general hospitals. So what Merck Foundation has done is, when they trained me, I was able to go into the community in Rizal, and sometimes in the province that's nearby. And from there, we are able to deliver healthcare. And from there, we're able to diagnose some diseases. And then that's the time we send them to the tertiary hospitals with referrals so that they would be able to get prompt medical attention. The education that I was privileged of receiving from Merck Foundation has definitely helped my community. It's very rare for a doctor to do further studies in the Philippines because of the many busy schedules and the needs of the community come first. So with the help of this education, I was able to acquire new knowledge and new skills. So at present, I've been helping the newly graduates of medicine in our community in San Mateo, Rizal. We have created a protocol for emergency room, and from there, that's the protocol that they follow for every patient that we have been receiving in the emergency. So thank you very much, Merck Foundation, for this privilege, and definitely we will be promoting the cause of Merck Foundation. Thank you so much.